In this video, you will learn about alcohol dependence and how VIVITROL with counseling may help treat it. Patients should stop drinking before starting VIVITROL. To understand how alcohol affects your brain, it is important to understand how the normal functioning brain works. The human brain is stimulated by everything you do. When you engage in an activity, your brain releases chemicals that impact your mood and feelings. When that activity is something you enjoy, your brain releases chemicals called endorphins that make you feel good. Endorphins attach to certain receptors, much like a key fitting into a lock, and unlock these receptors. When the receptors are unlocked, they release a chemical called dopamine in your brain. Dopamine gives you a good feeling to reward you for doing something you enjoy. This reward is what makes you want to repeat these behaviors. Many factors influence whether people will develop alcohol dependence or addiction. For some people, it is thought that drinking alcohol causes the release of a high level of endorphins, which results in an alcohol-induced euphoria, or high. When the good feeling ends, the brain makes some people want that feeling again. This urge can be very powerful. This is often a characteristic of alcoholism. Alcohol dependence is a chronic brain disease with physical and psychological effects. VIVITROL, naltrexone for extended-release injectable suspension, combined with counseling, may help treat alcohol dependence. Before we explain how it may help, there is some important information you should know about VIVITROL. Please see important safety information below. Please see VIVITROL medication guide and prescribing information on this website. Discuss any questions you may have with your doctor. VIVITROL is a prescription injectable medicine used to treat alcohol dependence. You should stop drinking before starting VIVITROL. Prevent relapse to opioid dependence after opioid detox. You must stop taking opioids or other opioid-containing medications before starting VIVITROL. VIVITROL must be used with other alcohol or drug recovery programs such as counseling. VIVITROL may not work for everyone and has not been studied in children. Do not take VIVITROL if you are using or still have any symptoms of physical withdrawal due to dependence on opioid street drugs or opioid-containing medicines, have opioid withdrawal symptoms, or are allergic to naltrexone or any of the ingredients in VIVITROL or the liquid used to mix VIVITROL. See the medication guide for complete information about opioid withdrawal and the ingredients in VIVITROL and the liquid used to mix it. How VIVITROL works in treating alcoholism is not completely understood. VIVITROL is thought to block the pleasurable feelings produced by drinking alcohol by attaching to certain receptors in the brain. VIVITROL uses special microscopic balls to slowly release the active ingredient naltrexone. The body breaks down these balls slowly, which release the naltrexone over a 1-month period. Therefore, you only need to receive a VIVITROL injection once a month. When added to counseling, VIVITROL may help you move forward in your recovery process. Please continue to watch for additional important safety information for VIVITROL. Before you receive VIVITROL, tell your healthcare provider if you have liver or kidney problems, use or abuse illegal drugs, have hemophilia or other bleeding problems, have kidney problems, have any other medical conditions, are pregnant or plan to become pregnant. It is not known if VIVITROL will harm your unborn baby, or are breastfeeding. It is not known if VIVITROL passes into your milk or if it can harm your baby. Be sure to tell your doctor if you have any of these other conditions before you get VIVITROL. If you are being treated for alcohol dependence but also use or are addicted to opioid-containing medicines or opioid street drugs, it is important that you tell your healthcare provider before starting VIVITROL to avoid having sudden opioid withdrawal symptoms when you start VIVITROL treatment. Tell your doctor about all the medications you take, including prescription and non-prescription medications, vitamins, and herbal supplements. Especially tell your doctor if you take any opioid-containing medications for pain, cough or colds, or diarrhea. Be sure to read and understand the medication guide before starting treatment. VIVITROL can cause serious side effects, including risk of opioid overdose. Using opioids, even in amounts that you used before VIVITROL treatment, can lead to accidental overdose, serious injury, coma, or death. To avoid accidental overdose, do not take large amounts of opioids or try to overcome the opioid blocking effects of VIVITROL. Do not use opioids in amounts that you used before VIVITROL treatment. You may even be more sensitive to lower amounts of opioids after detox, when your next VIVITROL dose is due, if you miss a dose of VIVITROL, or after you stop VIVITROL treatment. Get emergency medical help right away if you have trouble breathing, become very drowsy with slowed breathing, have slow, shallow breathing, feel faint, very dizzy, confused, or have unusual symptoms. Severe reactions at the injection site. VIVITROL may cause severe injection site reactions, including tissue death. Some injection site reactions have required surgery. Call your doctor right away if you notice any of the following at your injection site: intense pain, the area feels hard, swelling, lumps, blisters, an open wound, or a dark scab. Tell your doctor about any injection site reaction that concerns you, gets worse over time, or does not get better by 2 weeks after the injection. Sudden opioid withdrawal. To avoid sudden opioid withdrawal, you must stop taking any opioids or opioid-containing medications, including buprenorphine or methadone, for at least 7 to 14 days before starting VIVITROL. If your doctor decides that you don't need to complete detox first, he or she may give you VIVITROL in a medical facility that can treat sudden opioid withdrawal. Sudden opioid withdrawal can be severe and may require hospitalization. Liver damage or hepatitis. Naltrexone, the active ingredient in VIVITROL, can cause liver damage or hepatitis. Tell your doctor if you have any of the following symptoms of liver problems during VIVITROL treatment: stomach area pain lasting more than a few days, yellowing of the whites of your eyes, dark urine, or tiredness. VIVITROL can cause other serious side effects such as depressed mood. Sometimes this leads to suicide or suicidal thoughts and behavior. Tell those closest to you that you are taking VIVITROL. You or those closest to you should call your doctor right away if you become depressed or have any new or worsening depression symptoms. Allergic pneumonia. Tell your healthcare provider if you have shortness of breath, wheezing, or a cough that doesn't go away. Serious allergic reactions. Get medical help immediately if you have a skin rash, swelling of your face, eyes, mouth, or tongue, trouble breathing or wheezing, chest pain, or are feeling dizzy or faint. Common side effects of VIVITROL include nausea, tiredness, headache, dizziness, vomiting, decreased appetite, painful joints, and muscle cramps. In addition, common side effects in people taking VIVITROL for opioid dependence also include cold symptoms, trouble sleeping, and toothache. There are other important things you should know about VIVITROL. Please talk with your doctor to see if VIVITROL may be the right option for you. Be sure to read and understand the medication guide prior to starting treatment with VIVITROL.